Hi doctors, my name is Dr. Lama and the topic today is Malaise. Malaise is a feeling of general discomfort, of uneasiness, of being out of sorts, often the first indication of an infection or other disease. Malaise is often defined in medical literature as a general feeling of being unwell. Application in medicine. Malaise is a highly non-specific symptom, and cause can range from the slightest ailment, such as an emotion or a younger, to the most serious, cancer, stroke, heart attack, internal bleeding, etc. Generally speaking, malaise expresses a patient feeling that something is not right, like general wearing light, but only a medical examination can determine the cause.
So, Mika, your dad told me that you've been sleeping all day. How are you feeling now?
I feel like my heart is coming out of my chest.
Okay, let me give you a checkup and see if I can help you get better.
The following list gives examples of diseases and medication that cause malaise. Short-term infection disease. For example, acute bronchitis or pneumonia, acute viral syndrome, infectious mononucleosis, influenza, Lyme disease. Endocrine or metabolic disease. For example, adrenal gland dysfunction, diabetes, thyroid disease. And cancer. For example, leukemia, lymphoma, or solid tumor cancer, such as colon cancer.
Cells are abnormal cells. They cannot do what normal blood cells do. They cannot help the body fight infections. For this reason, people with leukemia often get infections and have fevers. Leukemia patients often do not have enough healthy red blood cells or enough platelets. As a result, the body does not receive enough oxygen. Without enough red blood cells, the patient has a condition called anemia. Anemia causes patients to look pale and feel weak and tired. Without enough platelets, patients bleed and bruise easily. In chronic leukemia, symptoms may not appear for a long time. When symptoms do appear, they are generally mild at first and get worse gradually. Doctors often find chronic leukemia during a routine checkup before there are any symptoms. Some of the common symptoms of leukemia include fever or chills, weakness and fatigue, frequent infections, weight loss, swollen or tender lymph nodes, easy bleeding or bruising. Other symptoms of leukemia include tiny red spots called petechia under the skin caused by abnormal bleeding.
Blood disorder, severe anemia, and medication, anticonvulsants, antihistamines, and beta blockers.
I've done the test, and I'm afraid Mika has anemia. It's a lack of red blood cells in her blood. Is it bad? Not if you treat it early. Let me show you. Red blood cells carry oxygen to all parts of the body. When they are low, less oxygen is getting around the body. This can make a person feel tired and weak. It can happen if iron or other foods are not absorbed correctly, or not eating enough iron-rich foods. This may result in bleeding in the mouth, esophagus, stomach, or intestines, vaginal bleeding, or heavy menstrual flow.
Long-term infection disease, IEDC, DS, chronic active hepatitis, disease caused by parasites, tuberculosis, heart and lung disease, congestive heart failure, COPD, and organ failure, for example, acute or chronic kidney disease, or acute or chronic liver disease. In Ecuador, if you have severe malaise, contact your healthcare provider immediately. Contact your healthcare provider if you have other symptoms with the malaise Malaise lasts longer than 1 week with or without other symptoms. And other symptoms, malaise may accompany other symptoms affecting the body, including abdominal pain and cramping, enlarged lymph nodes, fever and chills, flu-like symptoms, for example, fatigue, fever, sore throat, headache, cold, ache, and pains, joint pains, missed or irregular menstrual periods, muscular ache, severe fatigue, unexplained weight loss. Thank you.